So let's get started. So good morning, good afternoon, or good evening, everyone. So depending on where you are. So first of all, I would like to welcome you all to this panel discussion organized by Junior Faculty Interest Group of Informs. Let me briefly tell you what JFIG is if you're not familiar with it. So JFIG was created back in 2001 to promote the career development of tenure track faculty. Current officer teams include myself, Ruwei Jiang, who is Vice President, Roming Shui, who is Treasurer, Peter Zhang, Secretary, and Stanley Lim is Media Coordinator. Some of the signature events organized by JFIG includes Junior Faculty Paper Competition, Junior Faculty JFIG Luncheon, and our panel discussions. So the topics that we have been covering include industry-funded research and projects, publication and review process that has been scheduled during Inform's annual meeting, impact of issues related to race and culture on career of a junior faculty. It will be scheduled in November, and thereafter NSF funding or related to mentoring graduate students. So today we are here to welcome you to a panel discussion on medical and clinical collaborations in healthcare, a guide for junior faculty. This event is sponsored by Grado Department of Industrial and Systems Engineering, Virginia Tech, Systems and Industrial Engineering Department of University of Arizona, Industrial and Operations Engineering Department of University of Michigan. Now I would like to invite my fellow moderator, Sayed Tung from Virginia Tech, who is going to introduce our wonderful and illustrious panelists. Sayed, the floor is all yours.
Thank you so much, Manish. And hello, everyone, and welcome to today's panel. This is Sayed from Virginia Tech. Today, we are honored to have a distinguished list of panelists who have graciously agreed to join us to share their experiences, perspectives, and advice on medical and clinical collaborations in healthcare, which will be the main theme of today's panel. Let me begin with briefly introducing our panelists in the alphabetical order of their last names. We have first Professor Oğuzhan Alagöz. Professor Alagöz is the Procter & Gamble Bascom Professor of Industrial and Systems Engineering at the University of Wisconsin-Madison, where he is also a professor at the Department of Population Health Sciences and serves as the director of NIH-funded Institute for Clinical and Translational Research Simulation Center, as well as the Associate Director for Wisconsin Institute for Healthcare Systems Engineering. His research interests include stochastic optimization, medical decision-making, dynamic programming, simulation, risk prediction modeling, and health technology assessment. He has received various awards, including a career award from National Science Foundation, and he has been the principal investigator and co-investigator on grants more than $5 million funded by NSF and NIH. Welcome, Dr. Alagöz. It's a pleasure to have you here. Next on the list, we have Professor Brian Denton. Professor Denton is the Stephen M. Pollack Professor and the Chair of Industrial and Operations Engineering at the University of Michigan, where he also has a cross-appointment in the School of Medicine and is a member of the Cancer Center and the Institute for Healthcare Policy and Innovation. His research interests are in data-driven sequential decision-making and optimization under uncertainty, with applications to healthcare delivery, public health, medicine, and scheduled systems. His research has been recognized by several awards, including the National Science Foundation Career Award. He is an elective fellow of Informs, as well as past chair of the Informs Health Application Section, secretary of Informs, and president of Informs. Welcome, Dr. Denton. We are pleased to have you here today.
Thank you.
Next on the list, we have Professor Maria Mayorga. Professor Mayorga is a professor of Industrial and Systems Engineering at the North Carolina State University, where she is also with the Healthcare Systems Engineering Group. She uses techniques such as simulation, dynamic programming, applied probability, queuing theory, and mathematical programming to address fundamental research barriers in moving from estimates of efficacy to estimates of the effectiveness of interventions or policies by explicitly considering patient preferences. She is also interested in optimal allocation of resources in emergency medical service systems. She received several awards, including the National Science Foundation Career Award, and she is the current chair of the Informs Health Application Society. Welcome, Dr. Mayorga. It's a pleasure to have you here.
Thank you.
And finally, we have Professor Stephen Schachter. Professor Schachter is a professor of operations and logistics at the University of British Columbia Sauder School of Business. His primary research interests involve applying data-driven operation resource techniques, including stochastic optimization, dynamic programming, and simulation to improve decision-making in the healthcare industry. His research has been recognized with several awards, including the Career Investigator Award from the Michael Smith Foundation for Health Research. And he is the past chair of the Informed Health Application Society. Welcome, Dr. Schachter. We are pleased to have you here today.
Thank you very much.
So let me quickly go over the panel structure for today. First, we will begin with 6 to 8 minutes of presentations from each panelist, which will then be followed by a 20-25 minute open Q&A session. For the panelists, I will monitor the time and will let you know when we have about 1 minute left. And for the audience, please post your questions along with a very brief introduction of yourself through the Q&A platform or chat. And feel free to send your questions anytime during the panel. And we'll ask these questions to the panelists in the order of receiving them once the presentations are over. And as long as time allows, we will try to take as many questions as we can. Without further ado, let me start by inviting Professor Oğuzhan Alagöz to share his experiences and advice. Dr. Alagöz, the floor is yours.
Thank you so much for the kind introduction and for inviting me. Hi, everyone. Thank you for your attendance for this interesting presentation. So really pleased to speak with a distinguished set of speakers. So I'm going to make a 5-minute presentation of my sort of initial tips for building a collaboration. But let me first start with a brief summary of my experience in collaboration with medical, doctors and medical researchers, so that we're going to put this presentation in context. I joined UW-Madison in 2005 as an assistant professor, so it was a different environment back then. And prior to joining as an assistant professor, my only experience working with medical professionals is I've closely worked with an amazing, physician, Mark Roberts, MD from University of Pittsburgh, where I did my PhD. He was sort of my clinical co-advisor, along with my PhD advisor, and we met weekly, bi-weekly, and so and so. But then, when you join as a new assistant professor, it's like you are out of the water like a fish, and it's a little difficult. And in my initial, I'm going to talk about that later on, but over the last 15, 16 years, I will say I had approximately 15 healthcare researchers where I really had close collaboration, meaning meeting weekly, bi-weekly, or have some joint NIH grants or NSF grants. And I collaborated occasionally with lots of people, just like I'm a member of a NCI CISNET program, which is like a cancer modeling group. And just within the group, we have 25 people, and we meet every month and in person every 6 months. So I have had a lot of experiences working loosely with lots of folks, and I also had some long collaborations. My current collaboration, one of them is with 3 cancer epidemiologists since 2006. I work with an infectious disease physician since 2010, and I work with a radiologist for almost like 12 years. And I actually supervised the PhD dissertation of an MD PhD student. She's actually now doing her residence at the University of Michigan. And I also supervise students from Pub Health Sciences, their PhD dissertation. And so I graduated one student from medical school. And if you look into my CV, I have approximately 90 papers, and over 50 of them appeared in medical domain journals. And I primarily have NIH grants. Currently, I have 5 grants, and 2 of them I am the PI. They are NIH, and 2 I am the co-investigator for NIH, and I only have 1 NSF grant. So I have had a lot of experience working with medical professionals. So based on this, here is my sort of quick summary tips. My first experiences, again, as I said, back in 2005, your initial setup is extremely time consuming. Just to give you an idea, my first 3 years of faculty position, I met with approximately 20 different people groups, sometimes for several weeks, sometimes just one meeting. And only 2 of those initiatives worked well. One still ongoing, other lasted until 2018. The rest was really, I wouldn't say wasted effort, but it was a lot of time consuming, and I talked to lots of people, okay? So my first thing is you need to be patient. You gotta, be patient because initial setup is always very time consuming. Secondly, you need to find the right people, and not every healthcare profession is open for novel ideas and collaboration. And by definition, our ideas, mathematical modeling, complex modeling is quite advanced for many of these folks. At least in my institution and many of the academic, medical institutions, you need to find folks who are in the academic track in the medical school rather than in the clinical track. And that makes a huge difference because these folks have an interest in writing grants, have an interest in writing papers. And the other thing, as you start collaboration with a person new, there is a lot of things that you need to do as a typical collaboration. You need to be reliable, resourceful, and kind, and all those things with collaborations with non-medical people too. But for the medical folks, I will say you need to offer something valuable for the collaborator. So if you go to the person and tell them, oh, I have an amazing mixed integer linear programming idea and I just need data, it's not going to go anywhere. I mean, to be honest, even publishing in top IOR journals, which are not indexed in PubMed and, compared to medical journals, very low impact factors, is not very attractive to the medical, collaborators, okay? So based on my experience, I would say most of my initial work involved basic, simple statistical machine learning models of the, shelves machine learning models, okay? And the other thing is you can offer is, grant writing, at least folks in the academic track is very valuable for, especially in the NIH, CDC, AHRQ world in the US setting. And of course, especially as you move along, you want to have a strong publication record in medical journals because that helps a lot, okay? Other tips, communication is key to successful collaboration. You need to know how to explain your methods to non-experts, okay? And the second thing is, again, part of communication is you need to learn the domain area very well. Don't rely on the medical collaborator to inform you on everything on the medical problem, okay? My experience is I was able to do successful work only after I know the domain area very well. And for that, you need to attend conferences in the area. If it's cancer oncology conferences, you need to read articles, set alerts in the journals, okay? And one thing that I am also experienced over the last, several years is, climate is changing as well. Initially, it was very difficult to find good collaborations, but like in 2019, 2 years ago, I got an email from an MD PhD, whose email is like that. He emailed me, he said, I'm trained in machine learning, such as, natural language processing and deep learning methods. I'm interested in this problem. And I can already write an MDP model, but I need some expertise for my reinforcement learning. I wrote the paragraph, just like read it and then, validate it and give me feedback. So my point is, the climate is becoming more, positive for collaboration. So these are my sort of initial tips before the Q&A. Happy to take any questions, comments at the end of the presentation. Thank you again for having me. Said you are on mute.
Thank you, Oğuz. And thank you so much for a very insightful presentation. And as a quick reminder to the audience, please feel free to write your questions through the chat or Q&A at any time, and they will be asked once all the presentations are over. Next on the list, let me invite Professor Brian Denton to share his advice and perspective. Dr. Denton, the floor is yours.
Thanks, Sait. I think I agree with everything that Oğuz said, and I'm not that agreeable a person, so I don't always say that. So it was great advice, and I hope you can see my screen okay. I'll just give you a few observations that I've made over the years. I've been working on healthcare related problems with lots of different collaborators for about 15 years or so. And I've noticed some patterns and some things that work and some that don't. So I'll just throw out some of these. I think like anytime you get into a collaboration, you really have to think about what motivates, the person you're going to collaborate with. Doctors or administrative staff at hospitals, they're all super busy. So they're not really keen on just, donating their time. So if your goal is if you already decide what you want to publish and you want some data and a co-author, and you just want to do what you want to do, that's not going to be received very well. You might find somebody who's very generous and wants to help you, but it's pretty hard. So I think you have to really think about what collaborators care about. A lot are going to care about improvements in patient care, efficiency, cost reduction. They may be in it more for the possible outcome, practical outcome than the research. Those that are in academic positions, which is a minority of medical doctors, they care about co-authorship on publications. So you want to know, are you talking to somebody who is primarily doing patient care, and maybe does a little bit of research on the weekend once in a while when they have some time, or are you talking to somebody who's on the tenure track and is very hungry to get things done? You'll get very different responses from these different groups of people. And sometimes it's tricky, like here at Michigan Medicine, there's 3 different kinds of appointments. There's research track faculty, instructor track faculty, and then clinical track faculty. And it's the instructor track faculty that are on this really, somewhat pressured promotion and tenure clock. Research faculty tend to be working on specific projects with a PI. They're funded by those projects. They tend not to have a whole lot of extra time to explore new opportunities. But those that are driven towards getting research done are the ones that are going to be investing if they're excited about the work. Sometimes you'll find people that are really interested in, mentoring and offering advice. And then sometimes you'll find people that are a desire to learn something, like they want to learn something about quantitative models, and they want to work with you because they can learn something by doing that. And sometimes that can be a formal relationship, like with a NIH award, for example, where they're required to find some mentors with expertise, like K awards. So I guess that basically I'm saying, like, think about what's in it for them. And if there isn't much, it's probably not going to work out. In terms of finding collaborators, that's not easy. It takes a lot of work. I think Oz touched on that. I think he's absolutely right. But you don't need a lot of really great collaborations. One great collaboration could be fantastic. 2, 3, that could be amazing. You might end up talking to, 10 people and find one person that would really be suited to a strong collaboration. But I sort of have a policy that if somebody contacts me, I'll take 30 minutes to talk to them. Usually I'll bring a graduate student along with me because I know we're going to learn something along the way. Most of the time it doesn't really lead to a collaboration, but you learn something and you never know what's going to come out of one of those meetings. So networking is important. When I first got to University of Michigan, I didn't really have any collaborators in our health system, but somebody I knew at Duke, who I'd worked with, knew somebody at Michigan, and he introduced me to that person. So I met with them. Wasn't the right person for a collaboration, but they told me about 2 other people I should meet with. I met with them, and I essentially did like a somewhat random walk through the organization. I probably had, 12, 15, maybe more meetings. And then I hit the jackpot with a group that was doing things that I was very excited about. I had a lot of similarity with. So you don't know where you're going to find those collaborators exactly, but you have to invest some time. So people like department chairs can help you. If you get a chance to give a talk, like in grand rounds or something like that, or in, even a smaller group, that's a way to get, develop interest in what you do. The hardest thing I think is like cold calling people who wrote an article on something you're really excited about. Once in a while that will work though. So, I wouldn't rule that out if you have a very specific interest and you're trying to find somebody to work with. But I think that's one of the harder approaches because it's less likely to pay off. Yeah, if you're gonna have a successful collaboration, you know, time commitment is really important. So is this a person that's gonna have time to devote to the project or not? People often, like almost every meeting I have, I feel like people say, wow, this would be so great. This is amazing. Let's collaborate. It's gonna be awesome. But they really don't have the time, right? And I think they're genuinely enthusiastic, but they're enthusiastic about a lot of things. And so you need to, you know, find collaborators that want to make your collaboration a top priority. Some will be, you know, interested if this is going to lead to funded research down the road. I think, you know, one of the things you really need and a reason for collaboration is to have a competent team. So do you have all the necessary players? Like if you're going to do research on diabetes, you really need a clinical collaborator, I would say. If you're going to do a research on scheduling of chemotherapy center, you know, you need experts in there. And so ask yourself, do we really have the people that know how this stuff works or not? And then I think it's important to have some pretty frank conversations early on so that you avoid collaborations that don't really pan out. So getting a sense of, you know, what the collaborators you're going to work with expect, you know, what do they need to happen from the collaboration? What do they want to achieve? You know, does there need to be funding at the end of the day? Do they really care about a published paper? Or is that something that just doesn't matter to them for, you know, their career advancement? You know, I'd ask how much time can they commit, and suggest like a timeline, try to set some you know, milestones along the way. I know somebody who writes up like a memorandum of understanding, very detailed, that he signs with collaborators. I'd never gone that, you know, that formal, but I think it's really important to have these conversations, and sometimes they can be a little bit uncomfortable. And yeah, I think that's where I will stop. And I look forward to the discussion at the end of all this. Thank you.
Dr. Denton, thank you so much for a very interesting and insightful presentation. Next on the list, let me invite Professor Maria Mayorga to share her experience and advice. Dr. Mayorga, the floor is all yours.
Can you see my screen?
Yes, we can.
Okay, great. So I wanted to give a little bit of background about my research and how it evolved, because I also didn't start out in healthcare research until I started in my faculty position. So actually, I initially started working on supply chain problems, but I saw a connection between, you know, the customer and how that impacts the decisions for the firm, and a patient and how that would impact the decisions of clinicians. And so I really wanted to get into health systems when I started my faculty position. This was back in 2006, and I started at Clemson before coming to NC State. And of course, that has evolved over time with the current focus on precision medicine and seeing what the impact is on the population level. And so now, you know, all of that can be put into a lot of different types of research, and I don't want to bore you with everything, but what I want to get across with this slide is that there's different types of research, and so the different types of problems that you are going to be interested in are going to require different collaborations, right? And I also put in here some things that are not exactly health, but some of the other areas, and maybe you also have other interests that you work on besides health, like in this case, humanitarian logistics, also is really good to partner with people in the field, right? The domain experts. So you can't really do all of this research without collaborators. So here's an example of some of the collaborators. And what I want to show here is that there's both university level hospitals, for example, UNC, which is right down the road from me, but then there are these big hospitals like Mayo Clinic that really focus on research, but there are nonprofits. That's one potential partnership. And there might be tech companies that are interested in working or for-profit companies that do maybe managed care. So the type of collaborators that you may have could be really wide-ranging, and it's not always, you know, an MD sitting inside of a teaching hospital. So you have to kind of think broadly about what those collaborations might be. So how do you find all these people, right? That's what all of us have been talking about. So I do think that sometimes it's an organic process, but thinking about it, it's probably organic for extroverts, you know, because I tend to talk to people all the time. And so then we end up finding things that we're both interested in, and then it leads to another conversation. But really, most of the time, you're not going to hit that jackpot, and you're going to have to be very proactive about it. So a couple ways to help with that is to first make sure that people know what you are working on. Make sure that your all your colleagues and all of the people who are your potential advocates that you go to conferences with and talk with, make sure that they know what you're working on, because if they hear about something, then they might let you know or come to you. But if they don't know that you're working on organ transplants or something like that, then they wouldn't necessarily let you know when they come upon a collaborator. So just make sure that people know what you're working on. And then you also have to do your homework and find out who is active in the field. So that was what was alluded to earlier about, you know, reading the journal articles and seeing what is going on in that area. And then being active in professional societies. And this was already mentioned, going to more specialized conferences. So, you know, Informs is great, Informs Healthcare is great, but most of the medical collaborators are not necessarily going to be there. So you might have to go to, you know, a diabetes conference if that's what you're interested in, or a public health conference or something like that. And then there are the, I call them non-traditional events. I think someone mentioned one earlier, but one time we had, like, one of the schools of public health was doing this coffee and conversation. They were just having people come in and give 10-minute talks about what they were working on. Or Duke had like a, everyone just come and talk about what they're working on. So it takes time, and nothing may come of it, but you won't be able to meet new people if you're not in new places. And then the other thing is to manage your online presence, because I do think that people will sometimes search for keywords, especially if they're like in your area. And then if you don't have your work updated online, then they're not going to be able to find you. So I think we are all kind of in sync. So we also all talk about what makes a good collaborator. And so, of course, you have to have a match between the expertise and the area of research. And I think it was already spoken about what is mutually beneficial, right? What is their incentive and what is your incentive? And do they have time to see this motivation through? And I think beyond that also is the working style. Now we're all kind of long distance, right? So maybe we've all kind of learned to work via Zoom, but is it someone that you can work with over the long term? And one thing is that for me, a lot of my projects required multiple collaborators with different levels of engagement, right? So you might have the young tenure track professor who's really interested in making, in getting publications out, but they might have whoever their K award advisor is, that's also going to be somehow giving advice. Or you might have the person that's an epidemiologist, and then the other person who is the oncologist. So you might have different people, and they're all going to be engaged in different ways for a single project. And so I think some of the lessons learned thinking about this is it does take time. Everyone has already talked about it, and not everything will be fruitful, but really all the conversations I think are fun, and it's already been said that you learn a lot from them. It also be clear about expectations. We talked about time expectations, but I think also with publishing, right? So for medical people, having their name last on the paper tends to be what they prefer, and you usually want your name first. So good, everybody's happy, but what happens when people want different things? And we tend to, especially if projects are already ongoing, at the beginning, kind of outline what we think are going to be the papers and who's going to be the lead author on them. And, you know, they don't all necessarily come through and things might change, but that way you have the expectations from the beginning. If you're working with a company or somebody who might be implementing your algorithms, you need to have the intellectual property conversation early and probably with your institution, because the universities basically own our intellectual property, but then they might think that they're going to be able to implement it. So have that. And also about reporting, you know, most collaborators in medical field are working with NIH, which is really nice in terms of reporting, but you know, they're maybe not used to working with NSF. And then when you tell them that it's time to do the annual report, they might be like, I don't know, what is that? So make sure that that expectation is set if you're expecting them to kind of help with that. And then how is the student management gonna be between everybody? And I think we haven't talked about this, but everyone should probably have a talk with their department head and think about how collaboration is viewed for tenure. In some schools, they divide up, like if you're a co-author and that paper only counts some portion, maybe. In other schools, every paper that you're an author on, it counts the same. You know, is a medical journal going to count the same? Or what do you need to do to make sure that they value the medical journal that you publish in? So I think it's important to have that conversation with your department heads. And leave the lines of communication open, because some conversation you had several years ago may come back around to you if you run to that person again, or they decide now is a good time to work on something. And lastly, I think that like Dr. Denton said, like bring the students along, have them present. This is a really great experience for the students to be able to join in these collaborations. I think that's it. Yeah.
Dr. Mayorga, thank you so much for a very insightful presentation. And next on the list, our final speaker is Professor Steven Schachter. And Dr. Schachter, the floor is yours.
Great. Is this, are you seeing the full screen or are you seeing like the notes on the side?
We see the notes.
Ah, all right, let's see. I may be, well, okay. I'm just gonna, if anybody knows quickly how to fix that, but otherwise I'll just.
Steven, if you go to display settings, swap, presenter, yes, swap, presenter and slideshow, that should make it.
Excellent.
Yep.
Thank you. Good. Well, welcome everyone. And you know, going forth, there's not a ton of new things that I could offer that haven't been said, but I think there might be a couple. And if anything, it'll just reinforce a lot of the good things that have been said by my colleagues in the previous three chats. I'm going to talk about this in terms of phases of a chess game. So I'm going to talk about opening moves, the middle game, and the end game here, and then I'll add a couple of things after that. But you know, one thing that I think is really important that maybe hasn't been discussed yet is this idea of idea generation. Where are you going to get your ideas for new problems? And you know, one thing I like to do is, you know, periodically I'll look at recent back issues of New England Journal of Medicine, JAMA, Annals of Internal Medicine, Health Affairs, things like that. Look at, you know, say the New York Times health section, because, you know, like Oz alluded to, once you're starting off somewhere new, you're kind of on your own. You're like, okay, what am I going to work on? Where are my ideas going to come from? So I think, you know, for me, a lot of ideas come from, you know, just reading some of the, you know, health journals out there and saying, and trying to get some spark of an idea to then talk to some clinical expert at the university about and see if it might interest them as well. And this is something that's been talked about a fair bit already, is to also maximize opportunities to find medical collaborators. So one thing you could do is you could go to talks, seminars given by different departments at your medical school and or school of public health. You know, and don't be shy about going up to speakers afterwards or people who have asked questions during these seminars and, you know, just picking their brain a bit about, you know, do you think it would be interesting to, you know, explore this and have those conversations through these opportunities. And then if you could also, you know, have a chance to volunteer to give a talk on, you know, a very high level talk, you know, operations research in healthcare, kind of a knowledge translation talk, like this is my field. These are examples of things that this field has done in healthcare, as well as examples that might resonate outside of healthcare. You know, starting new opportunities might come about because you say, well, you know, our field has historically worked on problems in logistics and, you know, inventory management. And, you know, you talked about, you know, the blood bank at your, you know, at the hospital, and some of the ideas from, you know, traditional inventory management might apply in this hospital setting, and trying to build those connections that way. This has been discussed as well, the value of a kind of early quick wins. If you could get an undergrad student or a master's student to just work on a small project that could deliver value, something useful for the potential longer term collaborator early on, then it helps build confidence, it helps build trust that, yeah, these tools could do something useful. And then it's a bit of, you know, I scratch your back, you scratch mine kind of thing, where you're like, okay, well, now I'd really like to take a deeper dive. You know, could we occasionally, you know, pick your brain about this, maybe get some data and so forth, and convert that to a longer term, deeper dive kind of research endeavor. And that gets into the middle game. This is out of order, but I'll just put it all up there. So if you have some success with these early wins, smaller scale projects that maybe provide something useful in the span of say three months or so, which, you know, a lot of master's summer projects or undergraduate summer projects might be on that time frame, then you could, you know, look for opportunities to extend that. Or if you don't really see an extension to something, you know, more researchy, then you could at least, you know, have a coffee chat with the clinical collaborator. Just say, you know, what other problems do you face where, you know, you think that there's potential to use analytical approaches to improve decision making. This is also a good time to start engaging PhD students or postdocs for kind of the longer middle game of collaborating with clinicians. And then, you know, it's an incredibly gratifying area to work in. I think that's why we're all talking about this, and the panelists have been working for the most part in this area for so many years. But it also comes with frustrations. And we have to keep in mind that the doctors we're working with, they're busy people. And their first, you know, most important task is to care for patients. And so we have to respect that and understand that we might not get the response within 24 hours that we might expect one of our colleagues, you know, or one of our, you know, students or whatnot to respond within. And so, you know, I'm working on a project now with the PhD students where we're like, okay, let's figure out our questions very soon for a collaborator, because the average response time is 2 to 3 weeks. So let's start eating into that lead time and start working on other aspects of our you know, modeling while we wait for that kind of average delay. And then the end game, you know, this has been touched upon as well, you know, where to publish. And, you know, we don't need to necessarily think about clinical outlets versus OR, MS types of outlets. We could do both. And I think all of us, you know, a lot of our more successful research projects have led to publications in both clinical outlets, tailoring the work to a clinical audience and maybe leaving out some of the more mathy details. And then, you know, maybe taking a more theoretical and stylized approach to the problem and catering it to an audience of ORMS researchers who might be interested in some of the more advanced analytics involved in the problem. The other thing that I think, you know, I'm going to touch upon some things Maria talked about, and others that when you're working in medical publications, there might be a lot of authors. And then, what's the order of publication? And if it's in a clinical journal, the senior clinical collaborator often wants to go last. And again, as Maria said, that's fine. But these topics, and I'm just going to reiterate a really important point that Maria brought up, which is to really start educating your dean of research, your department heads, who may not know about the impact factor of this specialized clinical journal. They may not know that the norm in clinical journals is sometimes to have many authors, right? We don't typically see that in top tier ORMS kinds of outlets, 10 or so authors, right? But that's, we often see 3 to 4. On the other hand, in clinical journals, 3 to 4 is the exception, and more than that is the norm. So, that's something I would say personally for me, at the business school here, I had to have those conversations early on to talk about, these outlets may not be typical in the business school, but these are well-regarded journals in their respective fields in medicine, and to make sure you don't get shortchanged for publishing in appropriate journals that are very good journals, perhaps in a specialized area of medicine, okay? And then Brian talked about, seek opportunities to present in perhaps medical rounds, medical conferences. You can develop new collaborations there. I really put a big emphasis on trying to develop collaborations locally at your university. I think that leads to great efficiencies and often better response times and things like that. But certainly new collaborations might develop from a distance. And of course we could do that. And sometimes when you present at medical conferences, it opens up those opportunities. But presenting at the rounds at your university could be a great way to just find new people locally that you could work with. Just a couple wrap-up slides here. I was just thinking about, in preparing for this panel discussion, what would I say are common elements in projects that I've really enjoyed working on and that have led to, some notions of success. And I would say finding a clinical collaborator who really embraces quantitative methods in medicine. And so sometimes you could detect that with, have they done, for example, masters in health economics? Do they go to the medical decision-making conferences? Have they published in this area using some statistical methods? And so, the less you kind of need to sell what we're doing, and the more they're kind of already in that direction, the better. And, working with enthusiastic, energetic students, it's amazing what good students and those that are really passionate about the problem could do for the whole project. And in terms of types of work that I found tends to go more towards clinical publications. I think maybe it was Oz who talked about machine learning, statistical kind of models that is often maybe what they want and what they understand early on, and may lead to more clinical outlets. I would add another thing, which is perhaps discrete event simulation models, Monte Carlo simulation models. A lot of doctors are familiar with that methodology as well, or can at least quickly understand the value of it. And a lot of clinical papers out there in top tier clinical outlets use these kinds of tools from our field. So, and then in terms of pivoting and thinking about outlets that might be more on the trying to aim for good journals in the ORMS area. Well, after you build this detailed, let's say, machine learning or forecasting model or simulation model that's that resonates greatly and builds a lot of face validity for your clinical collaborators for the real problem, then you could think about building on that and thinking about maybe thinking about a stylized version of the problem, putting on a more theoretical or analytical lens and integrating it with that numerical study to put together this whole package of a good case study section of your paper, maybe preceded by some analytical results kind of section of the paper. And then, you know, I think Otis has had great experience working with many collaborators. He mentioned with the SysNet collaboration. I've had more mixed experience working with many collaborators. I find sometimes that gets into, you know, a little bit of territorial aspects with, you know, okay, you want this data, well, you know, write up this long detailed, you know, data request, and then, you know, we'll run the analysis. And sometimes it's harder to work firsthand with data when there's many collaborators, many different people working together in the group. At some point, you might start to build up a reputation, and you know, people are like, oh yeah, I see the value, and then they might say, oh, you know, can you help me with this and that, and you know, at some point you might think about saying no instead of yes, especially if you think that there's not great potential for converting this to a more researchy endeavor, and it's more just the near-term tool, and you see you don't see long-term potential. And then something to think about is, you know, kinds of things that, you know, come up in reviews and you know, that you get back when you try to submit your work to these, you know, to our journals in these areas is, you know, is this, how applicable is your problem to other problems, to a wider, more general set of problems that go beyond, you know, the hospital you're working with, right? And so you want to think about the generalizability of what you're working on to either other healthcare problems or non-healthcare problems where these tools can be used, right? Maybe what you're working on relates to, you know, reliability, and you can make a case for, you know, that this applies beyond just improving patient health, but, you know, improves system, you know, operations and so forth. Okay, so I'll leave it at that and look forward to Q&A session.
Thank you so much for a very informative and interesting presentation, Dr. Schachter. So that we will move to the next section of this panel, which will be the open Q&A. We have around 15 minutes remaining. So Manish, would you like to start first?
Sure. And first of all, I would like to thank you all. Like, it was wonderful to listen, and thank you for sharing. We get to read your papers, but the experiences that you shared was kind of a gold you're sharing for free. So let me start with this. First question is by an anonymous attendee is, how do you manage unsuccessful collaborations? Usually a research collaboration starts and midway you find out things are not working out. What has been your strategy to leverage and benefit from the time spent or the half work that is already completed? Appreciate any experience you can share. So we can go in alphabetical order.
I have had so many of those, so I can share some of my unsuccessful collaborations. So my strategy is, I think, Steven, you said a great thing. Like, you gotta learn how to say no at some point. Like, you need to know when to, you know, nicely break hearts. So I think my strategy is, if I notice that things are not going very well, I try to just wrap up the work, at least publish it in maybe not like the top best place, lower your expectations. Of course, you know, valid results publishing, and just say, you know, you need to move on. I think I don't like to leave any work, you know, if you already spent several months, I don't want to make it like unpublished, but there is always an opportunity for publishing. Again, it may not be the top journal in either OR, IE field, or in the medical field, but even at a reasonable place, I just like turn it into a publication package and move on. I think it's important skill, because you're going to have a lot of, I mean, not a lot, but some failures.
Anyone else add anything?
I think just having some of those conversations up front and getting a sense of what they really want, you know, collaborators, and you know what's driving them. It can help avoid some of those. I agree with everything O said. Once you get into one, you know, if it's not paying off as, you know, at least as much as the next best thing you could do with your time, then you should get out of that.
So it's maybe you want to, if we don't have any other feedback, we can go to another question.
I'll just add one thing to that, which is that, you know, sometimes, you know, I think honesty is often, you know, the best approach. And, you well, I always think honesty is the best approach, but in this case, what it means is that, some of the conversations I sometimes have is that I say, this, your problem's interesting. I think, that, yeah, we could create this kind of tool that will help, but this isn't necessarily the kind of work that, is gonna be most beneficial for, say, my PhD student when they go on the job market in terms of, showing, demonstration of more advanced analytical, know-how, or this is kind of a problem that's been explored in, many ways in our field already. And we could, I'll try to maybe get an undergrad or master's student to help develop, a tool, but and wrap it up kind of soon if you don't see the potential to extend it.
Yeah, I think that trying to, if you can transfer it to another person who may be interested, or like, for example, we have the health certificate program, so students can do projects, and can it be something that can be scoped as part of one of those projects? I know you have the Shep Center, right, Brian? So, can it fit somewhere else? And the key there, I think, is not to burn bridges, because that same person, because that means they are interested in what you have to contribute, may come back to you later with another problem that would be of interest to you.
All right, moving on to the next question. We have a question from Esra Toy. She asks, can you give some insights into collaborations with federal healthcare agencies such as CDC or AHRQ?
I don't know about AHRQ. I thought they were mostly funds, but like with the CDC and say the VA or other agencies like that, you really have to know somebody on the inside, and they also only fund certain places that they already have set up with. So in the initial time that you work with them, and it may not be directly through your institution if it hasn't been set up that way. They might work with another agency. Like, for example, all of my work with the CDC is through UNC, just because they have it already set up, and it's a lot easier for them to do the subcontract that way. So you kind of have to figure out who's there and how they're willing to fund. And I think the VA too, you have to have somebody who's in the VA, an affiliate, that can work with you, but you can't work directly with them.
Yeah, I'll throw out my experiences that, well, very different than NSF. I've never been a PI on a NIH grant. I was co-PI on one from AHRQ. Most of my fundings come from NSF, but I do work a lot through my collaborators. So I have PhD students and myself funded on NIH grants, but I found it more productive to sort of harvest the opportunities with my collaborators, and then to be part of a proposal. So we'll have an aim that's related to, the work that me and my research group will do. And it's often not exactly what I want to do. So sometimes I call it like an entry ticket. If you want to have a collaboration, there has to be something in it for the other person. So if it's a grant, I might sign up to do a cost effectiveness analysis. To be honest, it's not my favorite thing to do, but it's worthwhile work. And a lot of the stuff that you do will get you access to all the data you need, all the understanding, the knowledge you need to take things further, maybe in a direction that you're more interested in. I'm interested in sequential decision-making. And so along the way, if we do a cost effectiveness analysis, it lines things up for success for the next thing. And it's not a bad thing at all. You can publish that in a reputable journal, and sometimes that will get a lot more citations than, usually we'll get a lot more citations, for example, than something that's a little more methodologically focused.
Okay, so moving on to next question. So this is by David Griffiths. Question is, how do we sell our healthcare publication to our business departments when coming up for tenure?
That's you.
Well, I guess I might be the only one here in a business school. So, I'll start off. But I think it's a question for anywhere you're at. And so it goes back to a bit more like what I was talking about before, talk about, say in medicine, they look at impact factor, and this is a big measure of, quality of journal. Maybe, if we look at the impact factor of, say, like OR or management science, these kinds of things pale in comparison to the impact factors of, good medical journals. Now, the challenge sometimes is that in a business school, say they may be like really interested in what's on the, Financial Times top 40 list of journals, or, might have a narrower view of, what are A journals and B journals and so forth. But, I would say that, if they're bringing you on and they know you're working in healthcare, then, it should be a friendly, fairly comfortable conversation about that still requires you to the onus is on you, I would say, to really let them know, like, these are the norms, these are, good impact factors in these journals. And again, the quantity, don't be scared off by the quantity of authors on this publication. You might have to really clarify what your contribution was, and not just seem like, that you're just one of many and it's not a substantial contribution. So yeah, those are some things I would say.
So let me make it a little bit more general. So I think August mentioned about this related to balancing between publishing in a medical journals and ORMS type of journals. So how do you maintain that balance? Like you had like out of 90, 50. So how do you balance, or the other folks you can share?
So I think Stephen in his presentation made a really good point about the strategy. So the way that, at least I balance is, first of all, at the initial years of tenure, you need to be a little more strategic. If you look into my first papers, primarily I targeted ORMS journals. Medical journals, yes, I published 1 or 2, but if you want to get tenure, department's expectations, your community's expectations, you need to be very careful. But the general strategy that I followed is like any initial data analysis that goes into our models require a lot of data. Like if you have a DP, MDP, you have a transition probability, you have a reward function, and each one of them you could do more rigorous. And I published that work, like Stephen suggested, mostly in a clinical journal, medical journal, because you can't go with a partial observable MDP. Although Yakova, Susan attendee, published a paper in cancer using POMDPs, but normally you can't go with a POMDP to a medical journal. That's not gonna work easily. But these simple simulations, simple, machine learning models are publishable. And then there is always a methodological problem that I find, or it's a stylistic model. Then I target the ORMS. So the way that I find the balance is don't give up any one of them. It's just like easily understandable, low-hanging fruits you publish in medical journals, and then some methodology involves something that's more stylistic. I try to go to ORMS papers. So that's my strategy so far. But I think that training and the environment, like whether it's appreciated, that's a different level that I don't really have a lot of experience, because our department is quite diverse. So I never had any issues to convince anybody here that medical journals do matter. So
yeah, I have the same situation here. So here at Michigan, we have to make a case for why this is this is an excellent outlet to publish in. So, impact factor is one thing, but also how it ranks in an area. So if the journal ranks in the top 10 of 178 cancer journals, that case can be made. Or if it's a journal of a large professional society, I think the case can be made. They're looking for, is there a reputable group of people who believe this is one of the top outlets in the field? And I think Oz's point was great. Like, I look at it as an advantage. You know, okay, so we publish a medical paper, and we have to do a lot of the work anyways, you know, to be able to move on to something else. Like that might be something that we'd want to publish in a Informs or some other engineering journal, for example. Often I'll get a PhD student working with an undergraduate student where they can do some of the, you know, the basic analysis, you know, statistical analysis, some of these things that my collaborator really wants. And so then we put that out there, and then it forms some of the scaffolding for, you know, these other projects that we want to do that the collaborator is not so interested in, but once they see the value, they're happy to help and give some advice and be involved in that paper that you send to some journal that they have never heard of and appears to have an unbelievably low impact factor. But once they trust you, then you can get the collaborator excited.
So there's just a follow-up on this one. So this question is, how do medical collaborators value publishing in OR journals? By Hossein Peri.
I'd say very little. Sorry to jump in there, but there are not a lot of people in medicine reading those journals, right? So why would you publish, you know, important work to an audience that is not so interested in it? I'm being super pessimistic to make a point, I think. Maybe somebody can lighten it up a bit.
I think it can't be the only thing that you offer, right? You have to try to publish in a clinical journal, and then, you know, they probably won't mind being a co-author if they know what the work is about with you in the OR journals, but that can't be the only outlet for them.
I agree. And actually, especially some parts that we do for the work is meaningless. Like, why do you even prove this theorem? You know, like I had a lot of discussions why your PhD student is wasting 6 months on proving this theorem that I know clinically. Like, it doesn't make much sense. So I think it's not just the outlet, but some of the work involved may not seem very valuable. But to me, it's also our job to train these people. I mean, I think, again, some of my collaborators, and one of them actually, she wrote an article after 3 years using an MDP to calculate some threshold. Like, she is the lead author. She wrote it based on her understanding. I think we need to come to that. If you work with someone 5 years, 10 years, and if that person still doesn't know the value of math programming or DP, what it could achieve, that's also on us too. You know, maybe I didn't really do the sufficient training to the person. We can offer a lot of, you know, valuable stuff, but it comes with time. I think if your expectation is within the next 2 years, they will get what I am doing, it's not gonna, you know, I don't think that's realistic.
Say there is a question by Akos, so maybe you want to, this is the first one that we got in Q&A.
Yes. Yeah, so there's a question from Akos from MD Anderson, and he says, one thing that is often very challenging to overcome in collaborations between OR and a clinical investigator is the complexity of the OR approaches and subsequent implementation issues. Clinicians care about the practicality of the approach more than the method behind it. Any advice how to balance the two? You already, you know, got some insights about that, but if you'd like to add more.
I would say start off keeping it real and, you know, creating, I think, you know, a model that has often repeated itself in my collaborations is what I mentioned before, that, you know, build, you know, for example, build a simulation model that's going to capture a lot of the real detail that they care about. I mean, you're going to want that anyway to, you know, use this as a platform for testing any kind of, like, you know, analytically derived structural, you know, policies, and you're going to want to use, it's going to pay dividends in so many ways if you build something that's useful for them, captures a lot of, you know, the practical detail of the real problem, and it just builds face validity, right? It gets buy-in, but then it's going to be useful for your own, like, paper that you're going to submit to an ORMS journal, because you're going to have a numerical study section where you're going to test your policies based on your 3 propositions and 2 theorems, and you're going to use that as a test bed anyway. So I use simulation as an example, but, you know, like Oz mentioned before, some machine learning predictive tools could be tied in as well.
I want to maybe add on to that. So I think if you are talking about, I think the first thing is, yes, you can have the simulation or relatively simpler models that are easily understandable publication in medical journals. But then I think with your own work, you can go after not necessarily just operational, numbers, but general insights. So for example, you prove what the optimality of a particular policy that is within the subjective minds of the physicians. And you can show, that, for example, breast biopsy should be less, aggressive in older women. Like we proved that in our MDP model. Radiologists then understands these things. So I guess you may want to use your models to show certain general insights, like what we call managerial insights. Those things are very valuable rather than exact numbers. Sometimes those things could be, at least in my collaborations, they appreciated when we were actually showed things, rather than just like a simulation study where you can't do, like, how do you do resource allocation in a optimal resource allocation? You need to have an optimization model, right? So I think if you come up with those policy insights, my experiences, they were more willing to, go with your way. But that's just an additional one.
So let me take this final question. This is a question by Tim and Hoda both. So it's what journal and conference venues in industrial engineering that junior faculty work on clinical and medical research should focus on?
I think it depends a lot on what you're trying to accomplish. I mean, there's some that are at the intersection, like the journal Medical Decision Making, where some OR people are involved and publish in that. So that's medical decision making. Healthcare management science would be another example. Potentially. But yeah, it's so like diverse. I mean, the amount of number of journals in medicine is shocking. And so I think it really depends. Like, are you working on an issue that's so broad, of such broad importance that, it would be of interest to JAMA or New England Journal of Medicine? They want like New York Times front page story type stuff. Or are you working in something specialized, like a particular disease or something like that? And then there's specialty journals in all of these different areas, and huge number of them. I think if you want to establish yourself as somebody who's an expert in whatever, tuberculosis, I'll say, or thyroid cancer, which I think is a very open area, then you're going to want to figure out, like, what are the top journals? And just looking at impact factors won't get you the whole way there, because sometimes, one journal has a higher impact factor, another's lower, but it's the journal of the National Society. And many people think it's the top journal. You don't always have to be in the top journal, but if you're like, I try to be in like the upper 25% of journals. If you start going down to like the ones that are ranked like 140, these are pretty low quality. They don't attract much attention. People aren't very interested in.
Yeah, I want to mention, because I think it's very different than our field, is how medical people will approach publishing, because their review cycle is much faster than ours. So they actually will try to go for the best one. They'll usually make a list of, here are the journals that we are going to try, and they'll try to go for the top one, get a desk rejection, maybe, then go to the next. And they really don't mind doing this, because a lot of them have very similar limits in terms of words and figures, or you'd make it for the most restrictive one so that you can just then go in publishing. So I think that was something that I was, not used to at first, or I was always, I think in IE, I'm always thinking, what's the best outlet for this? What's the best journal that I think this will have success in? But they always kind of go big and then work their way down.
I totally agree with that. I would say too, I think it's important to look at what's in those journals. So like there's some journals that I know that, okay, yeah, they're open to simulation models, the use of models, that because I see people publishing papers in there. And then there's some that not interested at all. They wouldn't trust that. That would just not be something that they would publish. And so you have to kind of hunt around a little bit within your area of interest to figure out where you, what are the outlets that have a readership and an editorial board that would be interested in the work that you're doing.
Awesome. I think with this, we will wrap up our panel discussion. It was wonderful to have you as such illustrious panelists, and thank you all for sharing all your insights. And thank you to all the audience members for attending this event. We will be having more events for the JFIG, so stay tuned through JFIG LinkedIn page, or if you're a member, you will be receiving emails about the JFIG. And I would also like to thank Saeed for helping us in organizing this event, and also India Williams for, although she's at the backstage, but she's handling a lot of technical aspect that is working on. So again, thank you everyone. It was a pleasure to be here, and have a great rest of the day. Take care. Bye.
Thanks for having us.
Yeah, this has been an excellent panel. Thank you so much.
This is a lot of fun. Yeah.